everyone, welcome to 4sides with me Anjali. You're watching the special story from 4sides. Andhra Pradesh Medtech Zone is one of the world's largest medical technologies manufacturing cluster in Visakhapatnam with over 100 companies working on research, development and production of life-saving medical devices. However, the medical cluster zone, launched with much fanfare promising lakhs of investment, thousands of jobs and multifold increase in manufacturing capabilities, has been mired in controversy from day one. Beginning with the Landscam and accusations of land grabbing to facilitate the Medtech Zone, to the allotment of the infrastructure development to a private entity instead of APIIC as is the norm, and irregularities in budgets and corruption, the allegations have been. Not to mention what could otherwise have been a grave error amounting to crime, there has been the case of one bill of over 50 crores that was submitted twice by the construction agency and the officer in charge, making the payment twice.
AP Medtech Zone has been one of the most ambitious projects aimed at bringing industry to Andhra Pradesh in the early years of bifurcation for promoting medical device manufacturing. The Andhra Pradesh Medtech Zone, incorporated in 2016 under the aegis of TDP's Chandrababu Naidu government, is Asia's largest medical technology manufacturing cluster built on 270 acres. However, the project has been mired in allegations and discrepancies, so much so that the then opposition leader YS Jagan and YSRCP party members did not spare any words in their criticism of the government and the IAS officer in charge, Poonam Malakondaiah. So much was the noise that the project was kept on hold for a while before recommencing the development works. One serious allegation that AP Medtech has been dealing with is the case where the project construction agency, which is a consortium of PowerMake projects and its joint venture partner BSCPL Infrastructure, has submitted one bill twice, and this was in the year 2018. The bill of over 52 crore rupees towards construction work was not just submitted twice, but it was paid in double. Not only was it paid twice, but in order to do so, the officer in charge at the time, Poonam Malakondaiah, is alleged to have gone around the protocol to divert funds from National Health Mission. After all, at the time, she was Chief Secretary of Andhra Pradesh State, Principal Secretary for Health, Medical and Family Welfare, and also the Chairman of AP Medtech. Poonam Malakondaiah has been the other name for controversy as far as this project is concerned, especially when she allotted the development to a private entity. At the time, the then Health Minister Kamineni Srinivas, MD of AP Medtech Jitendra Sharma, and IAS officer Poonam Malakondaiah, Special Secretary Health Department, refuted the allegations and said that it is India's first manufacturing hub for medical devices and needs technical and scientific expertise for which APIIC, which should have been allotted the project, does not have the technical know-how. They blamed an ousted employee, Judith Raj, over false allegations. This was in the year 2017. When in 2018, a controversy over misappropriation of funds rose its head, once again it was Poonam Malakondaiah who is in the midst of it all. Audit was done on the construction agency and it was announced that there was indeed a payment made twice in November 2018, which was remitted directly by the Ministry of Health, Medical and Family Welfare Department to the escrow maintained in the name of PMBSPCL, in short the construction consortium. The agency was then ordered to refund the additional amount. To cut the long story short, the PowerMake BSCPL consortium paid back over 34 crores in the first installment, and it took bunch of reminders to finally get the agency to pay the remaining 18 crores only in 2023 May.
In this whole story, which looks like one happy ending, there are many questions that remain unanswered. Why has the project, which comes under the Ministry for Industries and Commerce, remained with the Health Department? How does the Department of Health take precedence and allot a project to a private entity? How can the funds of National Health Mission be diverted in the first place? Successive governments of Andhra Pradesh, be it the YSRCP or the earlier TDP governments, have been categorically ignoring the discrepancies and bending backwards to ensure all the parties invested in it are freed of any charges. One example to this is how the IAS officer involved in the grave error of double payment of bills, Poonam Malakondaiah, who was heavily criticized by YS Jagan, is currently the principal chief secretary in his government. All charges of financial and procedural irregularities on her, especially with regard to selection bids, have also been dropped by the current government. Thank you for watching 4 Sides with me, Anjali. See you all again with latest updates.